with me, Mr. Rowan Marriott. His podcast dropped yesterday. We're so excited. He talks about some great recruitment stuff. But I also have the wonderful Jenn Johnson, who I'm sorry is now a newly released, top released selling author on Amazon for nursing books on intuition and just how to survive your career as a nurse. So as in typical Mel style, I thought I would bring the most brilliant people together in the space of recruitment, retention, and burnout reduction. And I was like, look, you guys should talk to each other. And from that had a baby, and that baby is them going to the health conference. So we're very excited in Vegas. So go ahead, Jenn, say hello to the audiences and introduce yourself a little bit, and then we'll pass the mic to Rowan, and then you guys can kind of chat about how this all came to be.
For sure. So I'm Jenn. I'm your token Canadian. I'm an ER nurse of 16 years now. Have recently about to release my book.
I was like, wait a minute, I just learned one accent. I can't handle another accent to learn. I just learned Rowan's. I just learned Dean's. I can't handle another accent. Can you just keep it together, please?
It's apparently just the out and about is the majority of it. Yeah. So yeah, my book, Nursing Intuition, How to Trust Your Gut, Save Your Sanity, and Survive Your Career, is currently up for pre-release on Amazon, is already a top new release for not just patient and physician relations, as well as nurse and patient relations. So I'm over here dying my best death over here.
That's awesome.
But yeah, I am so excited to have hooked up with all three of you in the business world. Again, one of these things where everything happens for a reason, and that can't be nearly true enough in this sense.
Yeah, I agree.
Awesome, Jenn. Well, we're happy to have you. And Mr. Rowan, go ahead, Mr. Rowan.
Hello. So I agree with you, Jenn. It is a bit like the stars have aligned, and everything that we talk about just complements what it is that we're trying to do. So, I told you in the last podcast, Mel. So I'm the co-founder. I am the founder of AudienceLink, and we've got a really clear mission, which is to solve the staffing crisis in health and social care. It doesn't say the UK; it just says end the staffing crisis in health and social care. Full stop. So it's always been a dream of mine, since I set it up, to test what we do, the way that we do our work in other countries. And I went to Nashville actually to a big recruitment exhibition in my first year, and that was me dipping my toe in and asking questions, talking to people. And everybody I spoke to was just like, look, the way that you do your work, the values you've got, your commitment to doing things the right way is going to go down so well in the US and further afield. I got sidelined a little bit this year with my son, who I've basically been by his side in hospital for 9 months as he battled leukemia. But the great news is that he rang the bell, and that horrible nightmare is over. And what a way to kind of celebrate that when getting on a plane and going to Vegas. I've got to find my passport.
Rowan's like, I love you, Jack, but I'm going to Vegas, buddy. Like, you deserve it, Rowan. I mean, absolutely. All of us kind of behind the scenes have been knowing what's going on with you and your son this year. And, we as nurses, it definitely hit me. I got off that phone call the first time that you and I kind of chatted about, the opportunities in the US market, because for me, workplace violence is statistically linked to poor staffing levels, right? If you have staff that are overburdened and overworked, and we just don't have quite, even if it's one or two nurses that are missing from that unit, that can make a really big difference in regards to the safety with which those patients respond, because ultimately they are also in a safety environment where they are scared. And a lot of times that causes an emotional response that some people just don't know how to manage. And if you've got nurses running around at that same heightened level of fear and emotional response, it kind of is a melting pot for what we call, that real lack of tactical approach to the healthcare environment. And I think sometimes that's where organizations that want to provide a solution overlook the fact that workplace violence prevention is global throughout the hospital system. It has to not just security. It can't just rely on clinical. And, recruitment and retention take a really big part of that. And if your marketing team is using a large majority of your budget, or your HR department is using a large majority of your budget for personnel maintenance and other things, they should be included in those workplace violence and prevention initiatives, especially with all that legislation that's coming down. And I know when we were looking through the health conference material, so guys, these two are going to health as part of the nurse. Jenn has been accepted as part of the nurse approved area of the conference floor. Pause my long rant about workplace violence and pause and go to Jenn. Jenn, tell us, how did you get involved with that amazing thing with the wonderful Rebecca Love, and tell us where that's at, because this is huge for both of you guys. I think
this is, again, one of those things where, how in the world did I even get myself into this situation? I'm still kind of blown away that happened upon the opportunity, happened to apply, happened to get in. Am so excited to come together with the other 30-ish nurse-led businesses to really bring nursing to health, something that's been kind of lacking, or just not nearly as in the forefront in years past. So I'm beyond ecstatic to work with these nurses, because the things that they have developed and are the issues that they are tackling themselves are just so mind-boggling, and I'm so impressed. But yeah,
and what I love about your I was just going to say, what I love about your collaboration is that a lot of the entrepreneurs that are going to be in this section of health are looking for VC capital. They're looking for ways to launch their business forward. They're really looking for an opportunity to connect with people that are willing to take, a big chunk of investment or a big chance on some of these opportunities. The thing I love about your partnership is basically they're getting Jenn's IP, right? Sure, her intellectual product, and Rowan's literal proven $1 million savings stuff. So it's in exchange for a traditional startup, this collaboration is really important because the healthcare organizations can get value right away. And maybe Rowan, talk a little bit about that investment and kind of what the ROI looks like for an organization that joins AudienceLink's platform and ability to connect to people to retain and recruit staff.
Sure. Okay. So I think you said a really important point before that, violence, safety, and also adding on to that is, positive patient outcomes are affected with low staff numbers. So if you've got a couple of nurses missing from a ward, it's key, and it puts everybody under pressure. And if people are then using kind of temporary cover that are not accountable in the same way as permanent nurses, etc., it kind of breeds mistakes and it affects the patient outcomes. I think the other really important part, which is often overlooked, is it's not just the numbers; it's having the right nurses. Because nursing is such a skill shortage sector, and everybody wants the experienced nurses that have been there, that need less training, that can hit the ground running. I think there's a lot of things that are overlooked, are they going to be the right fit for an organisation? You've got individual hospitals and homes and hospices that they have a different proposition, a different feel to them. So if you ask the nurse who's been there for 3 years, why do you stay? What does it feel like? They will say something different than the next hospital that might just be down the street, So finding, understanding who the right people are for the organisation and to give that level of care is often overlooked. There's not enough kind of investment, enough understanding. And so what happens then is that there's all this money that's pumped into the attraction top of the funnel. Let's get the numbers through. Let's see how many nurses we can get to apply. We've got a nurse apply, rush them through the process. Hopefully they'll stick and they come through and it's here's the keys, here's the job, your experience, get on with it. Not quite as blatant as that, but I've heard scary stories.
No, that's it. That's pretty much it, Rowan.
100% it.
Yeah, okay, well, I've nailed that. But what happens next is that, not only will those people potentially leave that company after all that investment in in process and in recruitment and all that kind of stuff, but they might leave the sector. And that's why the staffing crisis in nursing, in healthcare, it just goes round and round and round, and it bleeds. And no matter what kind of big movements are made, it seems to me that a lot of the really important stuff is missed, and therefore it's never going to fix it. So I think this, like what we're talking about, what Jenn's doing, and some of the kind of services that we've got and that we've tailored, they are for nurses, they are for nursing, they are for the sector. They're not to make a load of money. They're not to, we've spotted an opportunity because healthcare is desperate. It's not about that. This is about, truly creating a legacy and getting to the end of it and going, we've made some real changes there. We've helped people, but not just patients, not just the business owners, but the nurses themselves. And I am rambling here, but I'm quite passionate about this. That I remember one particular briefing that I was doing, and I was speaking to two nurses in one room in a hospital, and it was a female personality disorder hospital. And I was saying to them, what kind of person do you attract?
Are you sure that's not every hospital?
No, I mean,
that's definitely an ER.
So what I'm trying to do in this situation is understand, who are we actually trying to attract? So instead of just numbers and nurses who are qualified, what kind of person needs to come in? So my questions were, what kind of people do you attract? And actually, it was people who actually need a lot of support themselves. So whilst, this particular hospital, they had all these benefits, all these different things in place, the real value, the real message was that they had on-site psychologists for the nurses, because they were coming in, and it's difficult, and they have this support structure. And it's this kind of thing that, I think give organizations the edge, because they're investing in their staff, in the real. And
there's lots of organizations, especially like the ones that will be at Health, that are investing because they are there to look at what's next and what's new. So there is an opportunity, because that means that they do take an active role in trying to determine, what is up and coming for their staff. So that's why I think it's such a neat piece of, collaboration that exists between you guys, because then you can offer something immediate that they don't have to wait for the long-term effects of to see while they innovate with another, really new kind of business idea. You have the support to give them something tangible now, while Jenn, builds out that development portion of the piloting that is associated with, nursing burnout reduction and the Love Work program. Because I think we both, Jenn and I both have been nurses for, at least over 15 years, and her for some time too. I won't put her age out there, but she's looks a lot younger than she actually is. That's all the extra blood that we drink from the drawing labs. We actually just ingest it. It's like J-Lo. Okay. We do vampire facials with all your extra blood, just so you know. Who needs the NHS benefits when we can get that? Like, that's the type of love work that I need, as an esthetician. But no, there are real hospitals that are doing things like that, like maybe have a nail day, or maybe have like some kind of spa where they give you a little treat, or their bathrooms are super nice. Like, some of these hospitals have the bathrooms like pimped out for nurses in there, and so like even simple things like that, I think, can add to the culture. And when we look at culture, understanding what it is that is different from marketing. Rowan said this really great thing the other day, and I hope I'm not like being too, sharing too much private information, but Rowan told me this story and it really stuck with me. He said, last night because he was in hospital with Jack and we were meeting, and he said, last night I actually got some decent sleep. And I said, oh, really? He goes, yeah, because I had a seasoned nurse come in and knew how to organize the shift, knew how to like make sure everything was done by the time it was like time to go to sleep. Jack was able to rest through the night. She came in and out. She was very quiet, very skilled. But because she had the experience of being able to say, okay, the computer and the tasks are not as important, checking off those tasks are not as important as patient care. That to me is the difference between hiring a random nurse that's just there because you've got a crisis, pay up, or the nurse that's going to stick it out with you because they like the culture of what they work with. No amount of money can entice nurses anymore. We've been through the ringer with COVID and we got paid well. And I would never go back to work unless it was a positive culture. And I don't care how much you paid me. And there are lots of great things that you can do to do that, but you have to be able to tell that story. And I think that's where Rowan and Jenn come along in, is telling the story in the beginning to attract the talent. Once the talent's there, Jenn's burnout reduction program kind of picks them up. And I hate burnout as a buzzword, but in Jenn's case, it's truly what it is, because her and I both had that experience, right, Jenn?
Oh, buddy. All of this was born out of burnout and wanting to trying to do something different, because what we were doing was no longer, we'd been pushed to the brink, pushed over the cliff. And now it's like, well, now what? Now we're just free falling. And it seemed like the smart ones got out at the time. So now that it's been 5 years almost, let's try and change the narrative around what it means to nurse, right? Like, why not bring in support systems for your nurse the second they are hired preventatively, versus, okay, now it's been 2 years in, you're burned out, you want to leave. Oh, well, let's try and throw some things at you last minute, throw stuff at the wall, see what sticks. And if it doesn't, I guess we can hire another nurse. Well, a lot of businesses are quickly figuring out you can't find another nurse. Like, they're just none to be had. So many of us have left. So many of us are down to either part-time or job share or casual. We're finally deciding to put ourselves first. So now we need the businesses to catch up to us to say, sell me you. It's no longer me selling myself to you. Now it's you sell to me. I know my worth. I need you to understand that I need to be supported. And I'm very curious as to how you're going to do that as a business. Even just bringing in 2-ply toilet paper into the bathrooms versus the 1 micron thick toilet paper. Like, it makes you feel like, guess where we're cutting everything from? Well, we're cutting it from what the staff end is, because the staff end, we're not really caring about. Well, now it's time we really care about the staff end, because that's who's going to be carrying you through.
Love it. So you know what? It kind of gives me, it does literally give me goosebumps when you're talking about that, because if you could imagine
on that.
If you could imagine
Rowan, go
or a healthcare environment for nurses where I hope we're still recording now. So an environment for nurses where you've got managers who genuinely spot the early signs of burnout,
yep.
who spot rising stress levels, who spot things like when people are agitated with the working environment and people. And actually have a framework to work with to deal with that. And not only that, but peers themselves have got that first level of support, so they know how to coach each other. They know what questions to ask of each other, and they are allowed to take that time out to kind of network within their own environment and kind of get that support. Because if that existed, that's the kind of thing that what we would love in AudienceLink, to bring that to life. And you go out to your target market, which, yes, it's already nurses, but it's the younger market as well. Yeah. Younger people who are thinking, what career am I going to have? Who might be full of empathy and care and fun, and you're all bonkers anyway, aren't you? But, full of all of these different things. And they don't know that they've got a career in healthcare. They just don't know it yet. But if you could bring to life this kind of dreamlike environment, which it shouldn't be that difficult to do, let's be honest. We're talking about healthcare, and it's about a caring environment where people have the time, investment to support each other and to make life a little bit easier for the people delivering this amazing care. That is a story in itself. And I think there is a huge opportunity to, stop the leaky bucket, to raise the profile and awareness of the sector as a whole. But then for individual organizations who do take the time to get it right, to say, look, we're different. We are one step ahead of the rest. They shouldn't have vacancies. They should have a pipeline of talent saying, I want to work in a place that makes me feel like that. Because, I don't where I work right now.
Exactly. And I think, like, as a travel nurse, I've been in a million different facilities doing all kinds of different things. And so I know that there's great brands out there like Massachusetts General, Johns Hopkins, University of Maryland. Like I could name drop, a ton of really good Inova, Centera. Like there's some really good hospitals out there. It's like their marketing on the branding side is great, but they miss this key portion, like how to tell the story of inside your hospital and inside that environment. And that's something that Rowan does so well, for, AudienceLink, like especially for like these home care agencies or organizations that are more spread out, mental health. He's really good at just telling the story of that organization and making it a brand that can grow because they have the staffing, so they grow with quality. And, revenue always flows to quality. Plug into Dean because he's not here because he doesn't love us and he couldn't make time. I'm just kidding. He's got other things to do today. But so Rowan, talk a little bit about your kind of, as an experienced kind of entrepreneur, looking at the potential of something like Jenn's burnout program, if an organization were to, sign up with AudienceLink. Take me through that, a little bit of that process. Like, do they reach out, they get something of value from you, and then in the back end, they can add on Jenn's program, right? Like a pilot sort of, let's see what we can do to help, reduce the burnout with the nurses, because you have this love work program that you've developed. And I think it just fits in so well in having something tangible to hand to nurses as they work through some of their, issues. We have a broken heart in healthcare. We really do. And so how do we heal that? And I think it's going to take the whole process of finding the nurse, recruiting that right nurse, and then growing them up in an organization to meet a culture.
Yeah. So we designed Love Work. Love Work is an experiential learning journey, is the best way to describe it. And it's a 2-day workshop, which you won't forget. So it's fun, it's engaging, and it's quite straightforward in that we want to work with managers to kind of raise awareness of things like burnout, early signs of stress, all the niggles that you have in your working environment. And as a busy manager, sometimes you overlook these things and you don't spot those signs because you're thinking of other things, maybe pressure from the commercial team or whatever it might be. That's kind of what one day is focused on, and which is a beautiful link to what you do, Jenn, and what your book is about and what you've been through and all the things that you can bring to it. The second day is purely for nurses, and it's for that peer-to-peer support, so that even if after the workshop and all the investment, the manager still gets it wrong. A lot of, I don't know what the stat is, but it's over half the people who leave their job leave because of their manager. It's just a fact. So even if you can't get the managers all to toe the line, if you've got that first line of peer-to-peer support, where they can recognize signs of stress, burnout, and the other things in each other, but have actually got a framework that they can use to talk to each other about it. And that they're actually, we've created this awareness. We've invested in this program of learning, so that actually opens the door for these conversations to happen. Then, the first line of retention for a company that's losing, key staff and struggling to grow, this will impact at that stage. The third element is about general well-being. So we've got a well-being collection, which has been designed again for nurses in the healthcare environment, which we believe people often forget about the time for them. And there's just little things that can kind of help, again, if you're working long hours or in a busy environment. So the Love Work program is designed, we've designed it for nurses. We've designed it for Las Vegas. It's for me to come over and bring over and say, look, this is for the US market. If all the research that we've heard, all the things that we've learned, all the conversations that we've had together, this really is what it's for. And, if we could help organizations to retain quality staff, if we could help nurses to improve their working environment and therefore the patient care, then you're right. The revenue comes with that, Mel, whether it's for the company, whether it's for us as a business, or whether it's for, nurses in their career. What an achievement and a fulfilling thing that is. And the thing is,
I love it.
We tested it and it works. It's true.
I think it's so. I was in the shower, obviously by my wet hair before this, and I found this little bottle of soap, and they used to be at the Hilton hotels, okay? And I'm like, oh man, because my son had taken the shampoo down to the cool shower downstairs at Mimi and Granddaddy's that has like whiskey barrels. And so, he's at that age where he wants to have his own space. So he's down there. So he took the shampoo. So I'm in there, crap, I don't have any shampoo. And I found this little bottle from Hilton. I was like, oh, I love this. Hilton shampoo is the best shampoo. And you know how I know it's the best shampoo? Because not many people know this, but Hilton used to host COVID nurses. They would allow us for the points. They would give you a free week. I think they gave us 2 free weeks during the pandemic. So I was able to go and stay. I only traveled as a travel nurse in Hilton hotels. So during COVID, we washed our hair all the time because you were afraid you were going to like bring home the stuff in your hair. And so, especially in ICU and ER when we're intubating and doing all this crazy stuff. So I used a ton of that shampoo. And you know what? I remembered that's why people want to stay at Hilton, is because the quality of the stuff. And I was thinking about how that pertains to this conversation that we were about to have. And that's exactly what Rowan is great at doing. So he has had recent clients that started maybe with like 40 or 50, 60 vacancies, and they were closed within less than a year. Almost every nurse vacancy. Like, Rowan, tell us how you're up for some awards for the amount of savings as far as ad spend and just some other brilliant things that he can bring to an organization, even if they were like, look, we're not ready for a burnout reduction program and, it's not the right time, but sure, we would love to, purchase a couple of copies of Jenn's book for our staff, but the things that you can do just with AudienceLink, not to mention like the Love Work program, are absolutely incredible. And that's what I think Jenn is being a benefit to see, like a seasoned entrepreneur that's got some real skin in the game that's done well.
So yeah, I didn't want to show off, but about an hour ago, which is about 3:00 in the afternoon my time, I got a message, I got an email to say that we've been shortlisted for another award at the HR Excellence Awards.
Stop.
Yeah.
No, that's 5, right? Are you up for 5 now?
It's incredible.
Come on.
I'm really proud of it. So, and they are for a mix of things. So, a couple of them are for like innovation in recruitment, and this is where we've ignored the usual routes to market, and we've looked at a company's employer brand and we've brought it to life with meaningful content that's real, and we've gone out to social, Google. We've taken people through a candidate experience that is engaging. And treats people like people, and they've applied for jobs and they've started, and everything that goes with it. We've got other awards for kind of best video, best attraction video, and also best skill shortage recruitment marketing solution. So I suppose there's a few stages. If we call ourselves a recruitment transformation company, and that's because we like to work with companies who want to change, who are up for doing something to improve and to basically create a sustainable resourcing strategy for the future. When we speak to a company, there's always quick wins that you can have. So we can, manage your budgets better on job. We can show you alternative routes to market. One of the key things we do is we can get under the skin, speak to, if it's nursing, speak to your nurses and understand why they joined and why they stay and why they leave. And then what we can do is go out to market with a real message. Because if you are going to the Hilton because you've heard that the shampoo is ace, and you get there and you're like, whoa, that's terrible. Look what it did to my hair. You'd never go there again. And it's basically the same for in nursing.
You were using Marriott shampoo, weren't you?
Well, then if you then look at the sustainable, the longer term solution, imagine if you've got an organization where you have got people leaving because of burnout, their managers weren't supporting them, and all the stuff that we've already talked about. Enter Jenn. You go and fix that. You've got something that nurses can come in, go through a program, and it improves retention, it improves their working environment, their life, etc., etc. That's when our message at the front end evolves, and like any brand, it's got to evolve. So we go from this quick win that we did of a real message, what it's like now, and we've got this aspirational new way of working, which because Jenn and your magnificent book and everything that you've brought into it is had an effect. We evolve that message, and then we can go out and say, look, we know why nurses came in and joined, but we're getting better, And it's a real message. We've invested in this program. So if you come in as a nurse to our organization, you'll go through this program.
We'll invest in you.
Yeah,
we'll invest in you. Like that's all people want to hear is like, I've invested $50,000 into my nursing education. Now I get out here and no one's investing back into me. They throw me out here with no training, no backup. And unfortunately, sometimes that just has to happen. Like you do feel like you're being lit on fire for the first 2 years. So any new nurses out here, that is not uncommon, but there were seasoned nurses around to help put that fire out. And unfortunately, that's missing. So we have to give them some kind of tools. And if you can't give them the actual seasoned staff, which I think that if you follow this trajectory, lots of nurses would come work for you that have been out or been retired, or even if you can design a program where they can pick up part-time or per diem, that amount, if you can use, and there's tons of like great AI staffing stuff now, like Audience or like In-House, who I said I was going to introduce AudienceLink to In-House because they have a way that you can, when you recruit the new talent, how do you put it into the schedule so that it doesn't collapse all of your people with 4 people on orientation at one time, like, and helping that nurse manager to be able to do those types of things. And that's where AI and the ability of like your, learning and the training that you have, that's cognitive based, right? As part of Love Work and as part of the other programs that you have going on. That's the important part, is how do you use the technology for our benefit, not for another burden. And I think that's what's scary about AI, and that's what's scary for organizations about bringing in an outside company. Oh my gosh, they're going to lift the hood and see that we do everything wrong. Like, no. Rowan comes from a place where there's like centralized healthcare, so that everything's sort of like under the hood, and the hoods have all come off. So you can't hide anything. You can get whatever information you want about anything over there. So they've already had the skirt blown up. So now it's time for Rowan to come in and be like, it's fine. Let's just like nurses. We were like, it's okay. We've seen it all. You're all right.
Yeah. So, the crazy thing is as well, is that, we talk about investment and finding that investment and lack of investment in your people. Something like the program that Jenn brings to the table, the Love Work program that I've been talking about, these are relatively low investments if you compare it to the absolute millions that is spent in this sector on recruitment advertising. And a lot of it is on spray and pray techniques where you just spend as much money as you can, you get as many applications as you can, and I hope it's going to stick. And you know what, it might not. But if you were to manage that properly, which is another thing, funnily enough, we do at AudienceLink, if you manage your campaigns properly, and where you should be getting free applications, you get free applications, and where you should be spending money on applications, you're spending money on the right kind of applications, not just thousands of irrelevant applications. That saving, it would only be a proportion of that saving would be equal to this investment, which then helps retention, which is the reason why you've got to attract all these people. It's not rocket science. But it does just change a little. It takes a little bit of a change in the way of thinking, a little bit of, okay, we're going to try and improve, and essentially just transforming the way that you do things. And I think that one of the biggest blockers is that companies don't like to change. And I've spoken to clients who, this is how much we spend on attraction. That's it. That's what we spend. There's
Jenn,
no science, there's no data.
I love what you said there, Rowan, about how much money you save on the ad spend. We'll go back to that. But Jenn, you're nodding your head like, oh yeah, I know how many times an organization's been like, oh, we want to change, but then they don't. Like their EVP does not match their values and vision. How many times have you seen that, Jenn, in your career?
Well,
and do you think that's had effect on burnout?
Absolutely. Because how many times can an organization say, oh, we're here for you, we're going to support you, there's a no violence policy kind of thing? Well, that's great when it comes to patients, but what about staff on staff? We're not dealing with, that's a whole other angle where we're not dealing with kind of problem children that also have a huge toll on a company's or a unit's burnout rates and things like this. But like just, currently I've had multiple different organizations who put out staff surveys. Oh, this is our once a year staff survey. And really it's all what do they say? Oh, it's all anonymous, but you have to sign in through your email to be able to get the link. So I'm like, okay, so it can absolutely be tracked back to me. So you're wondering, like, how honest am I being? Like, because I can be super honest, knowing full well it's not going to go anywhere.
Like, right. Or if it does, you could get fired for it. You know, 100%. A lot of nurses in the United States, I don't know if it's the same for Canada, but in the US, there's lots of at-will states. So it's difficult for nurses to really speak up. And that's why I think exit interviews are so important. Like, exit interviews are some of the biggest data gathering that I think I've ever been able to give an organization. See, like how I put that in there.
Same.
Rowan, go ahead, Jen.
Oh, sorry. Like I've left jobs, and so my very first job that I left, there wasn't even an exit interview offered. And so thankfully, because it was a very small hospital, I knew the CEO because, again, small town. And so I went and I'm like, hi, I'd like an exit interview as I'm leaving. And he's like, oh yeah, not a problem. This poor guy, I chewed up off his ear for like easily an hour. He brought in some intern after like 45 minutes to be like, I understand that you've got a lot to say and I really want to hear it, but I've got other things to do. I'm like, absolutely. I don't care who's hearing this, but somebody's got to hear it. And I went off, and it was, I felt so validated. I felt so validated just being heard. It just was so unfortunate that I was already, 5 years waiting to quit this place because there was just no other opportunities. But, I can tell you absolutely, if the 50% of people leaving is because of the manager, I honestly kind of feel that's on the low side. I feel like, people don't leave a job, they leave the manager. So coming at it from multiple different angles, coming at it with like exit interviews that trigger, maybe after 3 to 5 complaints about the same manager, maybe that needs to kind of get picked up and then put up to kind of a little warning sign to us to then maybe take it back to somebody else who's a little bit higher up so that we can try and start dealing with actual issues, actual root issues. Like, we need to get to the root versus just kind of pruning off the top of it.
Yeah, absolutely. Matt, if I ran a healthcare organization and I wanted to find out why the nurses were leaving my organization, I would do 2 things. One is I definitely wouldn't have somebody from my own organization conducting those exit interviews, reading from a template, asking a set of questions, and then, inputting into a system. That is a big no-no for me. And I know so many companies who do rely on that, and the data they get is just terrible. It's worthless. What I would have is an external nurse or group of nurses, not a company who do exit interviews as standard. I would actually get people from the same profession who understand the pain or the stresses or the reasons why, and give some real honest feedback. Because what should happen is at that point of exit, the information you get, that should feed right back into the beginning of the employment life cycle to say, what are we promising? Where are we getting it wrong? So if somebody's leaving because there was no career progression, but we're going out to market saying, join us, we can offer you great career progression, we'll support you all the way. They would just leave. But not only will they leave, but they'll tell anybody they can. So Jen, if you hadn't got that chance to speak that day, you might be, I don't know, on a podcast somewhere with your new book telling 1,000 people about that experience. But just in your own,
I choose no names because of legalities, but
of course,
I'd love to say I'm super healed from that experience. Man, I'm still pissed. It's been 16 years, and I left that job 11 years ago, and that bully has impacted me this much. So it's sticking.
But the cost of a poor reputation in recruitment is incredible. Like, I mean, one thing that the US has got nailed in a lot of sectors is employee referral. Something that, we don't do well enough in the UK, absolutely. But employee referral is massive. You get, all the stats suggest that you get more of the right people. They stay longer. They know what they're coming into. But who's going to refer somebody to an organisation that's like toxic, that doesn't support people, that doesn't, spot your early signs of burnout and your stress levels?
And then
one sheet toilet.
They didn't. They did employee referrals here and then wouldn't pay the referral fee for these nurses bringing their tons of hospitals I went to where nurses, I'd be sick because, you know, I did travel. I was a travel nursing supervisor as well. And so when I would travel around, you hear everything. Like, you want to know what's going on? Ask your night shift weekend nursing supervisor. That girl will tell you, or guy will tell you everything. And so I would hear that they would not be paying out these referral fees, or they'd be taxing them like 40-50%, and they wouldn't get it. I mean, these people were so mad, and that just totally tanked the brand of that organization, because they're like, oh, I referred my friend here, and now they're not getting $1,200 or $1,500 or $2,000 for a referral fee, and then you're paying the nurse a sign-on bonus of 5, 8, 10. Someone offered me one time a $25,000 sign-on bonus.
Yeah.
Then it got up to 30 and $30,000, $40,000 sign-on bonus. I was like, are you kidding? That's a whole salary of somebody else. Like, get me another CNA. Like, don't pay me. Bring in a CNA for that price.
Absolutely.
So it's crazy, isn't it? So I was once in a like a networking. This is going back years, but in a networking dinner with talent acquisition or recruitment leaders, and they were all talking about employee referral, and a few of the names in the room were recruiting software engineers in the same city in the UK, and you know, they were like rocking horse poop. You can't find them. They just don't exist. Because so one company said, well, we get all our hires through employee referral. And a few people were scoffing at it. Yeah, okay. How do you do that then? I said, well, we offer £7,500, which I don't know, is about 10 grand in dollars. And we pay it in the first month of that person being here. And they were like, no, you don't. No way. And they said, we do. Oh, well, what if that person, you know, left? Or what if this person joined and then they split the money? And they were like, yeah. But they don't. You know, maybe you might get one of those, but you know what? They'll never do an employee referral again. But we've got people who've earned 70 grand in a year from employee referral, and then they invest in making a place amazing. You know, they work.
Yeah, I bet they do.
And they've got a fridge full of cans of Coke or whatever. So, but it works. And you know, the other companies are, what are they doing? Using job boards. It's like, but they're not on job boards. These people aren't looking for a job. That's the thing that people that.
And they're spending that money marketing, right? They're spending millions of dollars on marketing and recruitment marketing, right?
Yeah,
and still having fall through.
They pay them straight away. You know, the person comes in, accepts the jobs, go through you call it orientation or induction as we call it, and boom, there's your payment. Thank you very much. You are, in fact, here's a monster-sized check, and we're going to put it on the website, share it internally. You know, let's do this. Let's get more. You know, I don't know. There are so many examples of where companies, organisations get it right, but they are slim pickings. And most of the other companies, they do what? This is the thing that gets me. They do the stuff that they did pre-COVID, and everything's changed since then. Candidate behaviour, the job board market, what people do when they apply for a job, all the ghosting, all this stuff. But they've not changed their processes. They've not changed their way of thinking. They are literally, crossing their fingers.
My favorite is when their marketing team makes like a TikTok video that was trending 2 years ago. Like they're doing like a TikTok trend from 2 years ago, and that's what their marketing department's like recommending. And I'm like, this is bad. Like, this is legitimate bad. You know, the one thing that I did see, I saw an assisted living facility and rehab facility that had a birthday party for one of their residents. Every time one of their residents has a party, the staff like get together and throw a little party. And they had like her coming in, they like put her crown on. They had like a red carpet. And like when she came back and they did a little surprise. And that, to me, if I was somebody looking for somewhere to work, that is the type of place that I want to work at. So like just showing lifetime, like the life and scenes of your organization, I think go a long way. And then giving the tools to the managers and the nurses to be able to sustain a stressful work environment and really give back to your employees and invest in your employees. And you don't invest in your employees with junk food and treats anymore. They're not the employees that raised me. You know, my preceptor, when I would make her mad, I would go to the snack machine and buy her a honey bun. Yeah. And then I'd give her a honey bun and she'd be so nice to me after she screamed at me all morning about how I kill people. Okay. So that's how we were raised. They're different now. You can't give one of these girls a honey bun because they're not going to fit in their little, you know, jogging scrubs. But anyway, you guys, it has been absolutely wonderful to talk to you. I'm so excited you guys are going to Health. Big shout out to Rebecca Love and the Health Conference folks for getting this all together. Organizations who want to get in touch with Rowan and Jenn for consultation about how AudienceLink and burnout reduction can help save your organization, be sure to send us a message. I'm going to drop a poll below, so make sure you answer some poll questions. It will be about what is the best break room snack, just so everybody knows. That's what it's going to be. I pick honey buns. So guys, thank you so much. I'm really excited. Be sure to check out their recent article on LinkedIn. I'm talking about love work and health, and we'll be producing some more content as we go along. So thanks for having you guys today.
Amazing.
Thank you so much,
Great
guys.
to see you. Jenn, I can't wait.
Bye.
Cheers. Bye-bye.
So pumped.